The health department is bracing for an expected surge in injuries related to firecrackers and fireworks as cases rise to over 50 with just days before New Year's Eve. Now, to tell us how we can give first aid for these types of injuries, joining us today is Philippine College of Emergency Medicine President, Dr. Jeremy Cordero. Hello and welcome to the program, Dr. Jer.
Good morning and happy holidays.
Now, first of all, let's start off with what are some of the more common firecracker and fireworks related injuries, yung based sa experience ninyo and based sa mga na-encounter ninyo over the years?
Yeah, so it's very important that the PNP Firearms and Explosives Division prohibits certain firecrackers and fireworks. No? Kasama na dito yung what we always know, the plapla, the piccolo, the watusi, mga Goodbye Philippines, Hello Colombia, mga ganung mga fireworks. No?
Original na mga pangalan.
I know the names themselves should be prohibited, but very important is we have to realize that there are certain fireworks that are illegal, especially to distribute in the market.
Okay, now, first of all, as much as possible over the years, no, sinasabi na let's not use fireworks. There's like common gatherings na lang, tignan na lang natin yon. But fireworks, firecrackers is so ingrained sa kultura ng nating mga Pilipino, no? So we can't really help but other people will really patronize in the revelry, no? So for those who decide who want to really use these, what are some tips on how to be safe, basically?
So basically, very important, especially for children, if they swallow or ingest these toxic substances. Most of these fireworks have substances like yellow phosphorus that's toxic to the body. So very important is do not induce vomiting in children. This might be more deleterious to their health. Also, be prepared with certain antidotes such as egg whites. Actually, the egg whites bind with the yellow phosphorus and could actually help in the excretion of these toxic substances. For children, around 6 to 8 raw egg whites. For adults, around 8 to 12 raw egg whites.
So yung raw egg white, pakakainin dun sa batang nakakain ng, of course, accidentally ng firecracker or fireworks, ano, yung, especially yung pulbura nun, like what you said, the phosphorus. Now, what about, let's say, other injuries? Let's say yung naputukan sa mata. Of course, some may be minor, of course, some may be major. Is there a gauge na pwedeng malaman ng ating mga viewers na okay gawin dito sa bahay or dapat dalhin sa ospital every time?
Well, certainly for eye injuries, it's always safer to send to the hospital and have an ophthalmologist assess the damage. No? But first aid is always to irrigate the eye wound or the eye exposure. Around just plain water, 15 minutes of irrigation just to make sure that all the debris from the firecracker is being washed away.
Okay, now, since we're talking about injuries with fireworks, firecrackers, you also mentioned the different names, may plapla, Goodbye Philippines. Let's use that as a scenario. Merong gumamit nito na malakas na firecracker ito, and yung daliri nila na injure or to the extreme, baka talagang medyo severe yung injuries nito, na amputate yung kanilang mga daliri. What is the first aid that they should do? Yeah,
thank you. And I apologize to those having breakfast this morning. But if we have traumatic amputations because of fireworks, if you can save the appendage as much as possible, time is of the essence. So we can put the appendage in a plastic, not in the direct ice itself, but always put it on ice, but in a separate plastic bag, so that the appendage, at the very least, if you could send right away to the hospital, at least there's a chance that the appendage could be reconnected. Okay,
so importante yun, ano, yung how you handle that appendage. Now, since we're talking about ice, you mentioned about ice, let's talk about burns naman. Yung mga nasunugan, either first or second, hopefully not third-degree burns, ano? Ang instinct ng mga tao, pag may nasunugan, lalagyan lalagyan ng yelo, lalagyan ng malamig kagad. Is this the right way?
Well, certainly the first thing to do, not more about putting on the ice itself, but usually to decontaminate the wound. So whether it be tap water or just normal water, normal temperature water is fine. But it's important to first decontaminate the wound, put on that water, and also to take off all of the clothing that could be exposed with that substances and all of those debris.
Okay, so we definitely want to prevent any burn injuries this New Year's Eve. Now, talking about the celebration of New Year's Eve, what is often neglected na pinag-uusapan is yung pagkatapos, yung paglinis. What are some safety reminders that we can give our viewers with regard to cleaning up after the New Year celebration?
Yeah, so like I said, sometimes we don't realize that the substances that we are exposed to during these celebrations, they stay on our clothing, on our on the furniture. As much as we can, we have to decontaminate. No, so always clean. Change your clothing, change the sheets if you can. And always, all of these substances, all of these fireworks should be taken away after the fireworks, because sometimes they forget that the storage of these fireworks are not adequate, and sometimes the toxic substances accumulate.
Okay, so may toxic substances yun. So ideally also, siguro basain muna before na walisin agad-agad. I'm sure a lot of people ang gusto linisin kagad, pero it's safer na basain muna para that extra amount of safety na nawala lahat ng mga nakasinding paputok.
Yeah, exactly.
Now, let's talk about, of course, with all these fireworks around, syempre yung hangin natin medyo na-affect din dito. Nakaka-inhale ang maraming tao nito, especially those with
asthma,
conditions like asthma or even COPD or even allergies for that matter. How can they help this? Is a simple surgical mask enough to protect them from the toxic pollutants in the air?
Well, some masks actually protect from these particulate substances, but we in the medical community always espouse prevention. If you can be in an environment with no fireworks or firecrackers, it's actually still better. But if you are with asthma, sometimes it's inescapable because sabi mo nga, hindi mapipigilan, it's part of our culture. Be prepared with the first aid for asthma like salbutamol for the nebulization, yung mga pausok natin, because sometimes the trigger for asthma or these conditions cannot be escaped during the holidays. So always be prepared for the plan B or the first aid for that.
Let's talk about some of the symptoms. Anong mga simptomas ang pwedeng maramdaman ng isang taong kailangan ng dalhin sa ospital dahil naapektuhan na yung paghinga nila?
Well, certainly, difficulty of breathing is the most obvious one. Sometimes it's chest pain, sometimes it's palpitation. So, and sometimes the substances themselves could trigger other symptoms like rashes or swelling in the face. So all of these symptoms, if you see them, just go to the hospital right away, especially if you don't have the medications on hand.
Okay, very good. So before we go though, Doc Jer, do you have any tips, advice, just to wrap everything up para safe talaga yung ating mga viewers this coming New Year's Eve?
Well, we want your holiday season to be safe. So always, prevention is better than the cure. So as much as possible, if you can prefer like public displays of fireworks rather than firecrackers itself, be careful with your children. Always decontaminate, and of course, avoid those foods that lead to accidents like alcohol.
Okay, there you go. So thank you very much, Dr. Jeremy Cordero, for joining us here on the program bright and early.
Thank you so much.